糖尿病这3个字一点都不陌生吧？在我们的身边，朋友的朋友，还是亲戚们里面呢，至少都有2、3位是患上糖尿病的。至少在杰西姐这边，马来西亚呢，这个是很平常的事情哦。那么在这一期开始大家有福了，从这一集直到下去的3集呢，都是由难得的马来西亚权威性糖尿病3口专科医生 Dr. Clement 来为大家详解什么是糖尿病和糖尿病贵阳之间的关系杰西姐好不容易终于等到 Dr. Clement 再度出来为大家详细的讲解这一方面的话题。因为自从上次就是良医有约那一部分到现在已经过去几个月了， Dr. Clement 一直都没有时间大家有没有发觉，其实如果有一个真正的糖尿病医生愿意花时间出来为大家详细讲解有关于糖尿病方面的话题，还要教人家如何去防止糖尿病或者预防糖尿病的话，其实很少医生愿意这样做的Dr. Clement 会为大家详解有关于到底什么是糖尿病1型和2型，然后如果患上了糖尿病，从头到脚对我们的身体到底会造成怎样的影响呢？然后如果是患上了糖尿病，到底会有什么的症状，就是心症啦。最后的话还会教大家如何要预防糖尿病，大家一定不容错过哦。那么这个视频其实是由1个视频来分成3个视频的，因为那个原视频实在是因为太详细它就比较长了。那么杰西姐不得不把它分成3个部分来讲解，然后是英文版的哦。但是大家不用担心，杰西姐都为大家放了中文字幕。好了，现在喜欢杰西姐就给一个赞或者订阅杰西姐吧。我们现在就开始。
We talk about diabetes and also diabetic foot ulcers. I'm Dr. Clement from Clinic Clement, and this is what we treat in our clinic. Okay, I think everybody has come across a friend or even families or friends of friends who have diabetes, but how much do we know about diabetes and what is diabetes actually? Tonight we're going to share with you the different type of diabetes and the diagnosis and also the treatment from there. Along the presentation tonight, if you have any question, you can type in your Zoom or your screen to ask us, and then we will collect all the questions, and then the moderator later will present the question, and then we will answer one by one as much as we can. Okay, so let's get started. There are 2 types of diabetes generally. There is a type 1 and type 2. So type 1 is a situation where our own body produce antibody to attack our own beta cells in the pancreas. So it is an autoimmune destruction process. So when this thing happens, it is responsible for damaging the beta cell in the pancreas, which is responsible for producing insulin. So when the beta cell is damaged, the beta cell in the pancreas is not able to produce enough insulin to digest the sugar in our body. So this is type 1 diabetes. What we are going to talk about tonight is a more, and actually the most common type of diabetes, where the majority of people of diabetes will be suffering from. So this is a type 2 diabetes. When we take sugar into our body, sugar will enter into our blood. So if we say, for example, if we drink something with sugar or eat a bowl of rice, the sugar will go into the blood, and then this will stimulate the pancreas to secrete insulin. So this insulin is actually a hormone. What it does is it transport and bring the sugar from the blood into the muscles for the muscles to use to generate energy for our daily activities. So there are 2 scenarios where type 2 diabetes can happen. Number 1 is when we take in a lot of sugar into our body, there is not enough insulin to bring the sugar into the blood, from the blood into the muscle. So when there is not enough transporter and there's a lot of sugar floating around, what will happen is the blood sugar in our blood will rise. Okay, this gives you the type 2 diabetes. And then the second scenario is the pancreas is producing enough insulin, but then there is an excessive amount of sugar that we are taking, making the insulin become higher and even more. So the persistent high level of insulin in our blood will make our cells become desensitized or tired and fed up with the insulin. It's like the insulin keep knocking on the door of the muscle, telling the muscle that, hi, guys, I'm delivering sugars into you, Mr. Muscle, and please take it. And the muscle got so fed up every 24 hours, non-stop, the insulin is trying to deliver the sugar. So you have this situation called the insulin resistance, and again, at the end, results in a high level of blood sugar. So this is a very simple diagrammatic way of showing you how insulin interact with the cells and allow the glucose or the sugar to go into the body, the cells. So the insulin here, the yellow mushroom-like figure, will need to come into contact with the cell at certain receptor, and then only then the sugar can come into the cell. So what actually happened in diabetes is there are plenty of sugars in the blood, and the effect will be the nerve damage and the blood vessel damage. And the sugar is less in the muscle because the sugars are not able to go into the muscle. So that gives you tiredness and lack of energy. Essentially, the whole scenario is summarized as sugar in the wrong place. How does diabetes damage us? You see, every part of our body needs blood supply. There is no part of our body that doesn't need blood supply, because every part of our body is a living thing. So diabetes damages our body by damaging all the blood vessels in our body. So the damage on the blood vessels are divided into the damages on the big blood vessel or the damages on the smaller blood vessel, which we call macrovascular damage, the big blood vessel damage, or the microvascular damages, which is a smaller vessel damage. So let's talk about the macrovascular damage, which is a big vessel damage. There are two things that can happen, and that is a myocardial infarction, that is a heart attack, and stroke. So in myocardial infarction, about 75% of the diabetic, they will eventually die of a heart attack. So in Malaysia, our average life expectancy is 76 years old. Somebody has done some calculation before, and it worked out to be, if you are diabetic, even if your sugar is under good control, you will have to take 6 years off from your life. Yes, 76 minus 6. If you're diabetic, plus if you have some cardiovascular diseases, you actually have to take off 12 years from your life expectancy. So for stroke, as for diabetic, you also have a higher risk of getting a stroke. But if you do have high blood pressure and high cholesterol, you have the extra risk of getting stroke. So the microvascular damage are the eyes. You see, many years ago, the number one causes of blindness in the world was trauma. But because diabetic is so rampant nowadays, the diabetes has become the number one cause of blindness in the world now. So diabetes damage the blood vessel at the back of your eyes, so it gives blindness to the patient. Number two is on the kidney. A diabetic with poor kidney sugar control, they will develop chronic kidney diseases. At the end of the day, they may need dialysis or even a transplant. If you cannot get a kidney to be transplanted, then dialysis is your only choice. The microvascular damage also damage the nerves. Diabetic patient, they will experience numbness, tingling, or in a later or more severe stage, you can even get pain. And all these things will stop you from sleeping well, and then you are just not a happy person because of this constant, almost 24-hour numbness and tingling and pain on both your legs. Diabetes damages the small artery in the foot, so people develop diabetic foot ulcer because the blood is not reaching the foot, and therefore the cells dies slowly, and also from infection and from diabetic foot ulcer. So to summarize, the end organ damages that can be caused by diabetes, let's count them 1 to 7 from head to toe. So the first one on the head is stroke. Okay, number 2 is blindness on the eyes, and then number 3 is heart disease on the chest, and then chronic kidney diseases that leads to dialysis or kidney failure on the kidney. On the lower part is sexual dysfunction, because sexual organs function pretty much depends on the supply of the blood. And then on the lower end of our body, on the lower limb, the feet are the diabetic foot ulcers. Something that we cannot see is our immune system. Diabetic patients have a lower immune system because the disease actually suppress the immunity of our body. So as you can see from the daily report in our COVID press conference by the DG of Health, you often hear that people who have diabetes or high blood pressure, they are the one who succumb to the COVID infection. And those younger people who have no diabetes, most of them, they can survive. So what are the symptoms of diabetes? Basically, there is no symptoms. If I look at a person, if he looks well from outside, there's no way I can tell if the person has diabetes or not. However, if the sugar level has gone up to a very high level, like 20 on above, like 20 plus like that, then you will start to see some symptoms. And they are the polyuria, polyphagia, and polydipsias, which what it means is you'll be eating a lot, and then you'll be drinking a lot of water, and then you'll be urinating a lot. But these are the quite severe high-level sugar symptoms already. But other than this, if you just develop diabetes, and your sugar levels are between 6 to maybe more than 10, you do not generally have any symptoms other than tiredness. So how do we know we have diabetes? Like I say, if you look at a person, there's absolutely no way you can tell. Unless there's one way you can tell by doing a blood test. HbA1c is the name of the blood test that most physicians or the doctors will do nowadays. It is more regarded as a more reliable and accurate blood test compared to fasting blood sugar, because HbA1c is a 3 months average of your sugar level that you can see from your blood. So what it means is if you're because throughout the whole day our blood sugar will fluctuate. It sometimes go high, sometimes go low. So which reading do we take? So the best way to measure is to take the average, and that is the HbA1c. And then secondly, of course, we can still do the fasting blood sugar, and then people who are age 30 and above in Malaysia, they are actually recommended by the Malaysian Diabetic Society to do a yearly blood test. So if you are 30 years old and above, and you have not done a blood test, I think it's time for you to do one now. Even before the age of 30, some youngsters who come to my clinic to do so-called casual blood screening tests and things like that, they are surprised that they found out that they are almost coming to pre-diabetic already. They are not fat people, they are skinny people. Things can still happen that way. So let's look at HbA1c. Like I say, HbA1c is a 3 months average of your blood sugar in your body. So this is the reading that we want to look at, to see if you are a diabetic or not. So I have drawn up a line here where I have a few cut off. What the first point is 5.6, and then the second point is 6.2. So if we do a blood test on you and I read your HbA1c, if you are anything 5.6 and below, then you are considered you have a normal blood sugar level. Anything between 5.6 to 6.2, you are in the pre-diabetic stage already. What it means is your body is having relatively higher level of sugar than normal, or it also means your body is not able to process the sugar like ordinary people. So if you go beyond 6.2, you are officially diagnosed as a diabetic. So there's only one way we can find out, and that is doing the blood test to determine if someone is diabetic. So how do we prevent diabetes? Quite simple, actually. There are only a few things that you need to do and some lifestyle modification. Then you can actually prevent diabetes happening in you. So first thing, and the most important thing to do is to reduce direct sugar intake. When you have your tea or coffee in the morning, try and learn how to take the tea or coffee without sugar. Milo is sweet. It has sugar inside already. If you're taking Milo kosong, that doesn't really mean kosong because it has sugar inside already. Canned drinks is a no-no, of course, because there is a lot of sugar inside. So it's directly drinking sugar into your body. Any packaged drink, unless it states that there is no sugar, otherwise there are sugars inside. Bubble teas, it was very trendy to drink it for the youngsters before the MCO, but now you don't see them anymore because of the MCO. Okay, the next thing is to reduce indirect sugar intake. What is indirect sugar? Indirect sugars are things that goes into your mouth that doesn't taste sweet, but then after entering into your digestive system, they all turn into sugar. And the most dangerous indirect sugar in Malaysia or in Asia is rice. Rice used to be regarded by some of the cardiologists as the biggest enemy of the Asian people because we eat a lot of rice. Perhaps in the previous generation, we are not so well off, so we ate more rice than the meat and the vegetable, and that had become a way of eating. And when we become wealthier and better off now, more well off now, I think we should change the proportion of the rice that we are taking, and not to add rice anymore, but take a quarter of the plate for rice, and then quarter of vegetable and quarter of meat, and then something else. Fruit, a lot of misconception about this because there are always a lot of patients come to my clinic asking me, "Oh, doctors, I take a lot of fruits because I'm trying to stay healthy. Is that good?" I say, fruit, you have to take it only in modest amount. The more you take, the more sugar you bring into your body. The type of sugar inside the fruit is called fructose, and fructose is more difficult to be digested by our body compared to glucose. So taking a lot of fruit can keep your sugar high. No added sugar fruit juice is also not so good because the fruit juice itself also already have a lot of fructose. And then the other thing we can do to prevent diabetes is exercise. Okay, the fourth point, how do we prevent diabetes, is avoid being overweight. Why I say that is because a lot of our Malaysians are overweight, and the maximum BMI for a healthy person is supposed to be 23 kilogram per meter square. So what it means is for a 1.7 meter person, your maximum weight is 66 kilo. But a lot of the time, we Malaysians are always more than that. So that's why we expose ourselves to the risk of getting diabetes. Low glycemic index food. Glycemic index, I will tell you more later on. Waist circumference. If your waistline for a man is 35 inches and above, you got to be wary and you got to be careful, because when you have a higher than 35-inch waistline, you will have an increased risk of getting diabetes. For the female, the cutoff is 31 inch. So for female also, if you are 31 inch, your waistline and above, you are starting to get a higher risk of diabetes. Sleep well and sleeping enough. This is not just a general recommendation, but there is a scientific study to prove that to you. So we are going to go into all these one by one. Now this is sorry. Okay, so waist circumference is very important. See the words here. This document was produced by the WHO, the World Health Organization, in the year 2008. Okay, so what it looks at is the waist circumference and the waist hip ratio. And if you have a high level of a high waist circumference, what is the relationship to diabetes? Inside this thick document, I only print out this page where it is the summary of the whole study. So they look at the body mass index and the waist circumference. Does it have a correlation to type 2 diabetes? And what they found is the relationship between body mass index to type 2 diabetes is plus, which means it is very strong. It has a very strong correlation between body mass index and type 2 diabetes. And they also look at the waist circumference. For male is 35 and for women is 31. So if you're above that, you are also definitely going to get diabetes in the future. So the evidence is also very convincing, and that is plus. So this slide is was taken by me when I attended a lecture given by Professor Dr. Kaizo Kanasaki in one of the hotel here when he was giving a talk. He is a teaching professor in Kanazawa Medical University. So in Japan, when we talk about Japan, most of the time we always think of the good thing in terms of health for the Japanese. They drink green tea, they eat very healthy food, they eat a lot of fish, and then they live a long life. True, those are the facts, but maybe it is not true anymore. If you look at this study that has been conducted by the Kanazawa Medical University. So what they looked at was the dietary nutritional trends and the relationship to diabetes. They started to study the total energy intake for the Japanese since the 1960. And since the 1960 until now, for 50 years, the total energy intake has not changed that much. That's why this line is quite clear, quite flat. And then for carbohydrate, in fact, there is a minor reduction trend that they are not eating that much carbohydrate. And then for fat, there is an increase of fat intake for the Japanese, and for protein is relatively flat on the red graph here. But if you look at the total energy intake, the carbohydrate, the fat, and the protein, everything's are pretty much quite flat, and there is no drastic change or something like that. But why is it that when you look at this brown color graph here, see from the bottom here, and then slowly going up, and then suddenly shoot up to this height, is the number of diabetes? Why are they not eating more than what they used to eat, and yet the diabetic cases are shooting up so significantly? They were puzzled. So they keep on looking for the reason why, and then they plot another graph, which is this purple graph on top of this diabetic graph. And what this purple graph show is the BMI. So what this slide essentially tells you is the fact that even if you are not eating a lot and there's no increase of what you used to eat, but if your BMI keep going up and when you keep gaining weight, your risk of getting diabetes is also following to increase. So this is the most important point that I learned and you should learn also.